Do you ever feel unusually tired, notice that your blood pressure is high, or wonder why puberty hasn't started yet? These clues can point to a rare condition called congenital adrenal hyperplasia, 17-alpha-hydroxylase deficiency. It is a lifelong condition you are born with, and understanding it early helps you stay healthy and grow normally. This condition happens when both parents pass on a tiny error mutation in a gene called CYP17-A1. The gene makes an enzyme named 17-alpha-hydroxylase, which is needed for the adrenal glands to produce cortisol and sex hormones. Without the enzyme, the body makes too much mineral oil hormones like aldosterone and not enough cortisol or sex hormones. The inheritance pattern is autosomal recessive, meaning a child must inherit the faulty gene from each parent to be affected. Because the body cannot make sex hormones, people with this deficiency often have delayed or absent puberty. Boys 46XY may have underdeveloped male genitalia, while girls 46XX may have very little breast development. The excess mineral oil hormones cause high blood pressure, low potassium, and sometimes swelling of the hands and feet. Imagine a teenager who feels constantly thirsty, gets headaches from high blood pressure, and wonders why their body is not changing. Those are typical signs. Doctors look for this condition with a few steps. Blood tests that check cortisol, aldosterone, potassium, and sex hormone levels. An ACTH stimulation test to see how the adrenal glands respond. Genetic testing to confirm a CYP17-A1 mutation. Treatment focuses on replacing what's missing and controlling what's too much. Low-dose hydrocortisone, a synthetic cortisol, keeps the adrenal gland from overproducing mineral oil hormones. Spironolactone or other blood pressure medicines lower the high blood pressure. Later in life, sex hormone replacement, testosterone for boys, estrogen for girls, helps develop normal secondary sexual characteristics. Regular follow-up with a pediatric endocrinologist keeps everything balanced. Because the disease is genetic, the best way to avoid it is family planning. If a couple knows they are carriers, they each have one copy of the mutated gene, they can talk to a genetic counselor. Carrier testing, pre-implantation genetic diagnosis, or prenatal testing can help families make informed choices and prepare for early treatment if needed. In the last few years, scientists have used next-generation sequencing to spot the CYP17-A1 mutation faster and at a lower cost, which means kids can start treatment sooner. Researchers are also exploring gene editing tools like CRISPR to correct the mutation in lab models, and newer long-acting steroid formulations that need fewer daily doses. While these advances are still early, they bring hope for simpler, more effective care in the future.